Diabetes, a global health challenge. Diabetes, a chronic condition characterized by elevated blood sugar levels, has emerged as a significant health concern worldwide. Recent statistics reveal that diabetes affects approximately 10% of the global population, underscoring its widespread impact on individuals, families, and healthcare systems around the world. Understanding diabetes. Diabetes occurs when the body either doesn't produce enough insulin, a hormone that regulates blood sugar, or cannot effectively use the insulin it produces. This results in hyperglycemia, or high blood sugar levels, which, if not managed properly, can lead to serious health complications over time. There are primarily two main types of diabetes. 1. Type 1. Diabetes. Often diagnosed in childhood or adolescence, type 1 diabetes is an autoimmune condition where the immune system attacks and destroys insulin-producing cells in the pancreas. People with type 1 diabetes require daily insulin injections to survive. 2. Type 2 diabetes. This is the most common form of diabetes, typically occurring in adults, though increasingly diagnosed in children and adolescents due to rising obesity rates. Type 2 diabetes develops when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. It is strongly associated with lifestyle factors such as poor diet, lack of physical activity, and obesity. Global prevalence. The prevalence of diabetes has been steadily increasing over the past few decades, driven largely by changes in diet, physical activity levels, and urbanization. According to the International Diabetes Federation, IDF, approximately 10% of the world's population is currently living with diabetes. This translates to over 400 million people worldwide, and projections suggest this number could rise to 700 million by 2045 if current trends continue unchecked. Impact on health and well-being. Diabetes is more than just a condition of high blood sugar. It has far-reaching implications for health and well-being. Complications. Poorly managed diabetes can lead to serious complications such as heart disease, stroke, kidney failure, blindness, and nerve damage, neuropathy. These complications can significantly impair quality of life and increase mortality rates. Economic burden. The economic impact of diabetes is substantial, both on individuals and healthcare systems. Direct medical costs for diabetes treatment, including medications, supplies, and hospitalizations, are high. Indirect costs, such as lost productivity and disability, further contribute to the economic burden. Psychosocial effects. Living with diabetes requires constant monitoring of blood sugar levels, adherence to medication regimes, and often significant lifestyle changes. This can lead to stress, anxiety, and depression in some individuals, impacting their overall well-being. Risk factors and prevention. Several risk factors contribute to the development of diabetes, including obesity. Excess body weight, particularly abdominal fat, increases the risk of developing type 2 diabetes. Unhealthy diet. Diets high in processed foods, sugar, and unhealthy fats contribute to insulin resistance and weight gain. Physical inactivity. Lack of regular physical activity reduces the body's ability to utilize insulin effectively. Family history. A family history of diabetes increases an individual's risk of developing the condition. Ethnicity. Certain ethnic groups, including South Asians, Hispanics, African Americans, and Native Americans, are at higher risk. While some risk factors, such as family history, cannot be changed, lifestyle modifications can significantly reduce the risk of developing type 2 diabetes. These include healthy eating, emphasizing whole foods, fruits, vegetables, lean proteins, and whole grains while limiting sugar, saturated fats, and processed foods. Regular physical activity, engaging in at least 150 minutes of moderate-intensity aerobic activity per week, such as brisk walking, swimming, or cycling. Maintaining a healthy weight. Achieving and maintaining a healthy weight through a balanced diet and regular exercise can reduce the risk of type 2 diabetes. Conclusion. Diabetes affects a substantial portion of the global population and poses significant challenges to health and well-being. Addressing the rising prevalence of diabetes requires a multifaceted approach that includes public health initiatives, education, access to health care, and individual responsibility for lifestyle choices. By raising awareness, promoting prevention strategies, and improving diabetes management and care, we can work towards reducing the burden of diabetes and improving the lives of millions worldwide. As we move forward, continued research, advocacy, and community engagement will be crucial in combating this global health crisis and ensuring a healthier future for all. If you enjoyed this video, be sure to like and subscribe.